All right. Welcome, everyone. My name is Patrick Diamond. I'm the lead for the Horizon Prize at MIT Solve. Delighted to be here with you all and to share this space, whether you're joining us in person here in New York or joining us from anywhere in the world online. Delighted to have you here. You know, in today's session, you'll hear from 5 truly impressive social entrepreneurs who will pitch their solutions to one of the most enduring challenges of our time, rare disease. These innovators have created promising solutions to help people with rare disease get the right care faster and more accurately. I'm so excited for you all to see and hear about their work, ask questions if you wish, and to connect with them after this session. Before we get started, I want to introduce you to my colleague and partner on this challenge, the Horizon Prize, Holly Copeland. Holly is Senior Director for Corporate Social Responsibility, Sustainability, and Impact at Horizon Therapeutics, where she leads the company's social impact work. Holly has offered to say a few words to tell you about the vision and kind of history and context for the challenge. So I'll turn it over to you, Holly, and then you'll hear from me right afterwards.
Thank you, Patrick, and thank you to all of you for joining us today for this very important conversation. We've long been members of the Solve community, but this year we're supporting an out-of-the-box, innovative initiative that has the potential to improve the quality of life for patients and their families. And that's what we've done with the Horizon Prize. You may know that there are more than 7,000 rare diseases affecting over 400 million people worldwide. People who have a rare disease often find themselves underserved by healthcare providers and systems. Despite these obstacles, we know that technology and innovation offer new ways of improving the lives of people all over the world. We launched the Horizon Prize in March, seeking solutions that would help us leverage big data and analytics to improve the detection and diagnosis of rare diseases, to promote community and connection among rare disease patients, their advocates, and others affected by their condition, to address the unjust and disproportionate burden of rare diseases faced by disinvested communities and historically underrepresented identity groups. And finally, to unlock collaboration by patients, scientists, and healthcare providers to improve patient outcomes. The 5 Horizon Prize finalists that you'll hear from today are doing each of those activities, using technology to improve the well-being of people impacted by rare disease. Thank you all for joining us today.
All right, so thank you, Holly, for your words and leadership on this incredible partnership between MIT Solve and Horizon Therapeutics. Delighted to have you here as well as everybody else. You know, here's the plan for today's session. What's going to happen is each of the 5 finalists will deliver a 3-minute pitch to you all. Judges and the audience will have the opportunity to ask them questions to further your understanding of their work afterwards for about 10 minutes or so. Our panel of 10 judges will then select up to 2 winners of the challenge later today based on the published judging criteria that's available on our website. And later today at around 4:35 in the afternoon, the winners will be announced on Concordia's Mainstage, so you can all tune in for that as well. So with that, I would like to invite our first finalist up, who is David Jacob, and he is the CEO of Think Genetic. So I will turn it over to you, David, and we'll get started.
Thank you, Patrick. As Holly so eloquently said, there are 400 million people like me living with one of 7,000 rare genetic diseases. The pharmaceutical industry spends $5 billion a year looking for patients like me because we're worth $4 million in revenue when we're treated. The problem is they can only find 25% of us. So when this problem was posed to us, we decided that based on our medical expertise with Emory, that we could find these patients. They're hiding in plain sight in the medical records. So we started with an undertaking to look for those patients in medical records, first with a contract with Takeda Pharmaceutical for the 4 diseases they cared about, and then with Lafayette General Hospital, who provided the medical records so that we could develop our solution. Whoops, where's the, whoops, back one. Sorry about that. So we did first, when we formed the company in 2016 at Think Genetic, we did a manual search of hospital records using genetic counselors that were expert in particular diseases, and they in fact were able to find the patient. So we knew we were onto something. So we built a solution that we're calling Finder, Find EHR, or Electronic Health Records, and it starts with a contract with pharmaceuticals, searching medical records, and flagging at-risk patients, in this case for the 4 diseases that Takeda cared about. And when we flag those, we then pass them on to a genetic counselor at the medical center to say, you need to investigate these people. They need to be diagnosed and put through some sort of genomic sequencing so that we can tell if they have the disease or not, and then on to treatment. Another part of that solution is also educating the physicians in the medical system on this disease, because most medical professionals have not seen these diseases. You're just not trained in one of these 7,000 diseases. So how is our solution working so far? We have 8 pharmaceutical clients, 3 hospitals. We just signed an agreement with Guardian Research Network, which will give us access to another 200 hospitals. We've generated $900,000 in revenue. We've raised $2 million in venture capital. And the reason we've been able to do that is through our management team. So Lynn Barker, Ruth O'Keefe, and myself have been in the technology business for 20 years. We knew we could build the technology, but we didn't have the medical expertise. So we added to our team the founders that you see here, Dawn Laney, who is my daughter, and also a professor at Emory and runs the clinical testing center there. I'm her patient. Dr. F.X. Campion, who is a practicing physician, but also a bioinformatics expert. And finally, Carol Ogg, who is a pharmacist and has specialized over the last 20 years in finding treatments with pharmaceutical entries for drugs. So we are now in the process of raising a Series A of $3.5 million. We believe that this will allow us to double our staff both medically and with genetic counselors, and we're hoping that we can grow the business through other diseases on our way to 7,000 diseases. Thank you. Okay, thank you.
And then if there are questions from the audience here, you'll have a chance to ask them as well. So I'll turn it over to Vanessa and Ida at this point to ask any questions that they have for David.
Have you muted?
All right, we've got you on screen, and it looks like we'll bring up your audio in a moment. Vanessa, maybe we could start with you. Do you have a question for David?
Yes, can you hear me now?
We can.
Yes.
Great. Thanks so much, Patrick, and thanks, David, for an excellent presentation. On behalf of the judges, we wanted to ask a question of you. So what are the requirements of hospitals? What do you require of them prior to using your technology, your Think Genetic technology?
So we're very sensitive to the medical information that the hospitals carry. So we've worked carefully with Emory and Lafayette General Hospital in Louisiana to make sure that we don't have any specific patient information. Everything is de-identified. The information comes to us, goes through our algorithms, we identify potential patients and flag them, and then push that flag back into the medical system so that they can evaluate their patients and see if they have the disease or not. So they have found that we're very careful at protecting their information. We make sure that we never know who the patients are, and then we follow up with them to make sure they have the right training and the right knowledge. Our genetic counselors will help them if they're not familiar with that particular condition to come up to speed on it.
Thank you.
Ida, how about you? Do you have a question for David?
Yes, thank you, Patrick. Thank you, David, for that wonderful project. As somebody who comes from Africa, I'm always interested in knowing what kind of approaches innovations do you have, like yourself? What kind of plans or strategies do you have into expanding into other locations and also expanding into other conditions?
Yes, so my vision has been since 2016 to cover all 7,000 conditions, although my medical and technical team says to me I'm a little ambitious and optimistic, but I think we can do that. We have to take them one at a time. We have expanded through our contract with Takeda to 8 countries, on our way to 50 countries. So we've actually had our algorithms translated for the 4 conditions they care about into the native language where the applications run. So we're very sensitive to that. And we are very cognizant of the other diseases. The trick is getting sponsorship and pharma buy-in so that we have the funding to actually build the algorithms and roll them out.
Thank you very much.
Wonderful. Any other questions from Vanessa or Ida?
No, I think we can turn it back over to you.
Wonderful. I'm not sure, I can't see behind me if there's any questions from the audience. We do have a microphone here if anyone wishes to ask a question. I'll give that a few minutes here, or a few seconds. Yes, if someone could help bring the mic over to our...
So one of the core questions that your organization seeks to ask and seeks to help fulfill is that you're trying to help pharmaceutical companies who are looking for rare disease patients. What is your plan for patients with orphan diseases whose diagnosis isn't backed by a large pharmaceutical branch?
Right. So, and that has been the challenge for us, which is the reason we're raising the Series A so that we can expand to other conditions. On our website, we actually have content on 300 conditions. It takes longer to build the algorithms and work with the medical records, so that's kind of a parallel process. And we think about that every day. So it's a fundraising problem of getting the contracts and the money from other organizations. We work with a lot of advocacy partners, so we're totally agnostic. We're not beholden to the pharmaceutical industry. It just happens that they have the most interest in our solution right now. We think there will be others that are equally interested, other advocacy groups and other partners.
Wonderful. I think that is all the questions that we have for today for Think Genetics. Thank you, David, for your presentation and your work on this. We
Good.
congratulate
Thank you to
on-
Horizon and also to MIT Solve for your consideration.
Thank you very much. All right. So the next finalist that we'll hear from is Dr. Sharon Hesterly from the Solution MDA Mover Data Hub. I welcome Sharon to the stage to give her pitch.
Hi, thank you all. So I'm Dr. Sharon Hesterly. I'm the Chief Research Officer at the Muscular Dystrophy Association. So I think what was abundantly clear over these last couple of years of the pandemic is that health disparities and inequality are real. We've been particularly for people who are living with rare neuromuscular diseases like ALS, muscular dystrophy, and related diseases. MDA covers almost 300 such diseases in our program. Dr. Susan Apcon, who is a physician who takes care of patients with Duchenne muscular dystrophy, decided she wanted to do something about that, and she used our solution Mover to do it. So Dr. Apcon asked, wanted to look at her clinic population and ask the question, are the children that she's seeing in her clinic with Duchenne getting the same level of care? And she used the Mover data, clinical data, to query that. And to her surprise, found that despite providing all of her patients with the same information, boys who identified as having a Hispanic background were using steroids about 60% of the time, compared to boys who were not Hispanic, were using steroids about 90% of the time. And as this is the standard of care, she was really concerned about that. And what it allowed her to realize is that providing equal care is not the same thing as providing equitable care. So the Mover data allowed her to ask this hard question and to work on her own solution in her clinic. So Mover is a data hub that collects data from patients in multiple different diseases and is able to aggregate all of that data and make it available to scientists, clinicians, and also industry who are interested in health disparities and gaps in care. It's powered by the MDA Clinical Network, so we have care centers across the U.S., 150 care centers where people with any of these diagnoses are seen for care. We see about 60,000 people a year in these care centers. So what we've done is leverage the ability to collect data from volunteers who participate to be in this program. So the data is removed from the medical record and it goes into the MDA Mover Hub. And right now we have about 50 centers participating out of this network and about 4,000 people entered into the database. So this is just an example of the Mover data visualization platform that Dr. Apkon used to do her analysis. It's being used across all of the care centers. So the individual care centers, investigators can query their own populations, and they can also look at aggregate de-identified data across the network. So we're very excited about the opportunity here today for Mover. We've built the solution. We've got a critical mass of data. What we're looking to do next, and we think MIT Solve is a great partner to do that, is to actually build out some additional capabilities for Mover. For example, to be able to collect data directly from patients, because as we know, not everything that's important about your health is included in your medical record. So by pairing the data directly from patients with their medical record data, we'll have a more powerful data set. We also are interested in figuring out how to make this model, continue to make it sustainable as we go out to all 150 care centers, and also consider an international approach by partnering with other groups. So in short, we have a very small but active team that I am honored to work with on this project. They oversee all the aspects of day-to-day operations for all of those sites and all of those medical records, including data analysis, quality assurance, data cleaning. But we just want to thank you very much for the opportunity to present, and we hope that this can be a real way to make a difference in the lives of many, many people living with rare disease.
Wonderful. Thank you very much, Sharon, for your presentation and to the MDA Mover Data Hub team. Again, I'll turn it over to our two judges who are representing the panel of judges that we have to ask a few questions. And if anyone in the audience wishes to ask a question as well, you can head right to the mic now so we can have those asked afterwards. So I'll turn it over to you two, Vanessa and Etta.
Well, thank you very much. Thank you, Sharon, for the presentation. My question would be, considering that currently the data that you've collected and the patients that you've worked with are in the US, do you have any plans, should you be successful, to extend or expand to other regions?
To expand to other countries, is that the question?
Yes.
Yes. So I think the best way that we could do that actually is to allow other people to use our platform. So if we can allow groups in other countries to use the same platform, they can still own the data or maintain control of the data. We just need the data to be compatible. So by sharing the platform, that ensures that we have data compatibility. So that would be our solution for moving out beyond the US.
Okay, thank you.
Vanessa?
Yep, thanks for this excellent presentation. I have a two-part question. So could you just elaborate a little bit on your approach to partnership with these care centers? And then also what your sort of vision is for expanding coverage to other diseases?
Yeah, so we have a long-standing relationship. We've had this care center network in place for over 30 years. So we make grants to each care center to help underwrite the cost of running that center and supporting care. So for us, it was actually relatively easy to put agreements in place for Mover. It's usually something that would take a very long time if anybody has worked on site agreements. We've been able to do this fairly rapidly because of the long-standing relationship we have with those centers. And they're very eager to participate because what they're getting back in return is the ability to analyze their own data. And if you know medical records, most EMR systems don't really allow you to analyze data, especially across different patient groups. So this allows them to do that, and it's been a very good relationship. And the second part of the question, I'm sorry, I forgot what the second.
No, that's okay.
Okay.
Could you just elaborate also on your sort of vision for expanding to additional diseases or additional conditions?
Right. So this is a really scalable solution. After having built the platform, we can continue to add diseases. Right now, we have 7 neuromuscular diseases on our platform with room to add many, many more. We have a lot of diseases we cover that are ultra rare, and the goal there would be to have a case report form that actually is not specific to each individual disease, but for which we can cover a lot of the common things across those diseases. So we should be able to add a lot of the rare, ultra rare diseases in that way. And again, we can continue to add diseases that are part of MDA's program. We can certainly share the technology to add diseases that are outside of MDA's program. But having built the platform, it becomes very scalable.
All right.
Thank you.
Thank you.
Any other questions? Oh, yes, we have a question from the audience.
Hi, thank you for your presentation. I just had a quick question. How can you elaborate on how you deal with data privacy, and is that a factor at all in how you expand your platform?
Oh, definitely. So that's something that we're very conscious of in rare disease. Even with de-identified data, it can be sometimes easy to re-identify people. So we have partnered with IQVIA to develop that uses a proprietary data de-identification solution. And we actually are implementing it differently depending on the number of people. So for the largest population we have is in ALS. We have almost 2,000 patients. We have one solution for that group. And then we have other groups now where we only have about 100 patients. And in those cases, you have to do more rigorous de-identification of the data. And so we have applied those different solutions depending on that population to try to preserve as much of the data information as possible, but to be conscious of the fact that it's easy to de-identify those data sets. So.
All right, we have another question from the audience.
Thank you very much for that presentation. Two-part question. I was struck by the comment you made regarding the Hispanic community whose children are at 60% medication to 90% medication. And it caused me to ask this question is, to what extent does your data take into account the cultural competencies associated with that, with the various demographics, A, and B, given the variables nowadays for mixed families, the racial and ethnic variabilities, to what extent does your algorithm take that into account as well?
Right. So I think you're asking two questions. I'll answer the second one first. We use standard categories that are very similar to the categories that are used by the U.S. Census. That doesn't, I think it's pretty good at capturing the major ways people describe themselves. One thing that I think we need to add and we need to change are people who want to pick more than one category. That's always a challenge when people identify with different ethnicities. Right now, they're probably putting down what they think is the most common, but that's one change we'd like to make. And then the other question is, do we take into account the different cultural competencies? The data itself is what it is. I think the data, really we used to find things like Dr. Abcon found that despite giving the same information, she was getting different results. So the data just is able to highlight those issues where there are differences in how people are receiving information and how they're digesting and acting on that. So the data just allows you to identify the problem, that there is a problem. Then I think you have to do more digging to understand why and to come up with a solution. Sure.
All right. Thank you very much, Dr. Hesterly, for your solution, MDA Mover Hub, Data Hub. Thank you, and we'll move on to the next finalist at this point. All right. So you've heard from two of our finalists here so far, and now you'll hear from the third. I want to invite a virtual finalist to the stage, or to the screen rather. So you'll hear from Ali Salim from the solution Elsa Health. So what we're going to do is actually show a pre-recorded pitch first, and then he will join us live for some Q&A as well.
There's no oncologist in the villages of northern Tanzania, and there's no genetic testing either. Maybe there's a pediatrician here and there, but almost certainly no other specialists. This means that when your daughter is born with a congenital defect in her lungs, there's limited resources and skills available to save her life. That's a sad reality for our friend Godfrey, whose daughter passed away just a few days after being born. No one at the facility was able to identify the early signs of a rare condition that ultimately took her life. My name is Ali Salim, and I'm the CEO and founder of Inspired Ideas, the company behind the Elsa Health Assistant. Misdiagnoses are common in healthcare, and a recent study by the World Bank showed that 4 out of every 10 patients are misdiagnosed at the primary points of care in Tanzania. For patients with rare diseases, this number is significantly higher due to the condition complexity, nondescript symptoms, and lack of skilled healthcare providers. The Elsa Health Assistant is a clinical decision support platform that puts specialist level decision-making into the hands of healthcare providers across emerging markets. Powered by artificial intelligence, data, and expert knowledge, the Elsa Health Assistant supports providers in identifying the cause of a patient's illness, predicting medication adherence, and providing actionable next steps based on national guidelines. Healthcare providers use Elsa as they see their patients. They can access the platform either through our custom software, or we can integrate with existing information management systems already available at their health facilities. Our solution optimizes the health decisions, increases the provider confidence, and improves healthcare outcomes for their patients. Elsa currently is in use by 53 healthcare providers across Tanzania, supports decisions for 5,000 patients a month, and covers over 60 conditions. We're on track to cover more than 300 conditions in the next year, and we work very actively to develop the platform with the users and beneficiaries to ensure easy integration and uptake, even in the most remote villages and health facilities. Elsa's tools and algorithms are built to be scalable, allowing for growth to new geographies with different disease distributions. And within the next 5 years, our goal is to power health decisions for 10 million patients annually across the continent. To do that, we're grateful for all our partnerships with healthcare leaders across Tanzania, as well as funding and mentorship from MCC PEPFAR, UNICEF Innovation Fund, and Foundation Partner. Our team has strong experience and expertise in artificial intelligence, software engineering, public health research, and digital health implementation. We believe that individuals with rare diseases across the African continent deserve high quality care, and the Horizon Prize will help Elsa improve her ability to identify and provide early intervention for more than 50 rare diseases at primary points of care, ultimately impacting the lives of millions of people. Thank you.
All right, so you just heard from Ali from Elsa Health, and if all goes according to plan, he's joining us live on screen here along with our two judges. So I invite the judges first to ask some questions, and for those of you who are here with us in New York, feel free to come up to the mic and be ready to ask a question to the team here. So with that, I'll turn it over to Vanessa and Edda.
Thanks so much, Patrick. And congratulations on an excellent pitch presentation. As you think about growing and expanding your model, what is the process for adding new languages and sort of cultural sensitivities to your solution?
Thank you. We work with health experts as well as community leaders and the community itself. We elect an ambassador from whichever community we're going into, and we try to make sure that we understand what is considered taboo, as an example, and what isn't. And we work with them to translate any part of the application or the platform that needs interaction with the users, because the algorithms themselves are separate and they can work in whatever language is being used for.
Thank you.
Okay, thank you very much for the pitch. As you might be aware, Africa is one of those regions with very low levels of diagnostics, even though we have millions of rare disease patients. So how affordable is your platform going to be? And secondly, how is it going to integrate with the knowledge that our health professionals have?
Thank you very much. These are some of the questions that we're currently and actively trying to deal with. So for the first question on how is it going to be affordable, or rather how much will it cost? A majority of our technology is currently open source or is going to be open source in the future. We're planning on making it as affordable as possible, only necessary to be sustainable. And since it works offline, it can be deployed and not unmaintained for a very long period of time, and can be scaled quite easily because it's simply copy and paste as opposed to deploying new healthcare providers. In terms of integration, We deal with this challenge everywhere we go. It turns out that different areas have different regulations and policies around how data is stored, or even infrastructure and availability of infrastructure. So we build our technology to be easily black boxed and hidden away and integrated into any healthcare system that we can find. And the healthcare providers themselves are trained ever so slightly, but we've built multiple versions of the same application so that the AI can communicate with different literacy levels in the easiest ways possible. And we actually have a few studies on this that will be coming out later this year. And I really hope I got both questions there.
Yes.
Okay, thank you.
Other questions from the judges?
None from me.
No?
All right. There is a question here that we had from some of the judges who are not here. So Ali, what would this prize mean for you? What would you do with the funding if you were to win? How would that power your next phase of your solution?
Perfect. This is great because the whole team would go on vacation. No, I'm just joking. We're going to use the funding and the prize to expand the number of diseases we cover to cover 30% of the diseases that we have right now. So we're going to scale up our diseases to 1,000 over the next 5 years, and 30 to 35% of those will be rare diseases. We're going with the approach of if you can eliminate other diseases, it makes it easier to be confident in the rare ones.
All right. Thank you very much. That's a horn from someone else, not from me. But I think we don't have any other questions from the audience. So we want to thank you, Ali, for your pitch and for presenting on Elsa Health, and for the judges for asking those questions. Thank you very much, and you can tune into the main stage session later today for the winner announcement.
Thank you very much. It's great.
All right. Well, round of applause for Elsa Health. Next up, we have our a fourth finalist. This is Emily Wang, presenting the solution Research to the People. So I invite Emily up to stage, followed by questions from the judges as well as the audience. Welcome, Emily.
Thanks, everybody. Thanks for being here today. I'm Emily, and I'm a co-founder of Research to the People. And we are creating a new medical system for patients with rare disease and rare cancer who have exhausted their clinical options. And our ultimate aim is to give everyone in the world access to personalized medicine. Research to the People was founded in 2017 because there are no current systems or solutions helping patients for whom clinical data and research has failed. John is one such patient. He is chronically undiagnosed, even with the best clinical sequencing available at multiple institutions, until he came to us at Research to the People. Oh, sorry. I think I'm missing a slide, actually. Okay. In 2019, we hosted a hackathon for John at Stanford, and we provided long-read sequencing with Oxford Nanopore and PacBio, in addition to proteome and metabolomic sequencing at no cost to John. We gathered together over 100 bioinformaticians, geneticists, and credentialed researchers from around the world to work on the case together. They came from countries like China, India, Germany, Canada, and the US. And we also garnered support from many institutions, including sequencing and genetic support and event space from Invitae, as well as computational support from Google in the cloud. And we are a platform that supports open data, open research, and open results, and open participation. And all of John's data and results from the researchers are openly available on our platform. And at this hackathon, we uncovered a TNXB mutation, which was indicative of Ehlers-Danlos syndrome. And John says that this was the best weekend of his life because he finally found a solution to his misdiagnosis. We continue to have support from many institutions in academia, government, and technology. who have provided us with events-based sequencing and funding, including Alexion, a pharmaceutical company, which provided us $250,000 in seed funding for our patient case, with Gigi here, who is in the audience today. And this way we can sequence data to the deepest levels with all the data listed on this table here. And all of our hackathons continue to garner support from researchers around the world, hundreds of researchers at every hackathon, and therefore we've built up a network of thousands of researchers around the world who are able to continue to work with us. And we're excited about the past cases that we've hosted. We've successfully hosted 4 cases so far, including one this past weekend with Vanessa at Stanford. For 9 years, she's been treated with a desmoid tumor. But we're really excited because at this hackathon, we discovered that it might not be the case that she has a desmoid tumor. And we're looking forward to our upcoming 3 cases at Stanford this next year. And what I love the most about our patient platform is that that all of our patients are incredibly supportive of each other and continue to support each other in our mission to this day. And our model seems to work, so we're excited and we want to scale. We're currently building a software platform that allows patients around the world to have access to education and on types of data and sequencing that they can generate with us here at Stanford. And in this way, we also connect people with researchers around the world as well on our platform, and therefore patients can access next steps for their care and treatment. And we're excited to be expanding to institutions across the US with whom we have connections. And we're also excited to be expanding to other research connections that we have around the world through our program here at Stanford. And in the next 5 years or so, we'll be we're currently building out the platform. In the next 6 months, we'll be fundraising and continuing to build out this platform, as well as in the next 5 years, expanding to institutions around the world and with whom we have connections for our research. And this starts at MIT Solve and Horizon Prize here today. We're excited to potentially partner with MIT in launching one of our cases here at MIT, as well as taking advantage of MIT's Solve's global connections as we expand internationally. And additionally, with the Horizon Prize, we're excited to potentially work on rare disease education and sequencing education, as well as further boost research in diagnostics and biomarkers for patients with rare disease. And at Research to the People, we're all about the people. We're very excited to be working with leading scientists and researchers and students and patients from around the world. And thank you so much for having us here at MIT Solve. We're very excited.
All right, thank you so much, Emily, for that pitch and for your team that's here today. Again, I'll turn it over to our 2 members of our judging panel to ask a selection of questions from the rest of the judges. And I invite members of the audience, of course, to ask questions at the microphone behind me as well. So with that, perhaps we'll start with you, Vanessa, and then we'll hear from you, Etta, after that.
Perfect. Thanks so much. And congrats, Emily, on a great presentation. Just for the audience, the Vanessa that was referenced in Emily's presentation is not me, so there is no conflict of interest there. So just a question from the panel of judges. If you could just elaborate a little bit more on your business model and your approach to scaling beyond a small subset of conditions or a small subset of people who are served by your model, that would be great.
Yeah, absolutely. So on the slides there, we host cases for patients with all sorts of rare illnesses. We've hosted 5 cases so far with patients with rare cancer and rare disease. And we've also have 2 undiagnosed cases. So diversity is definitely not an issue here. We can host a case for anyone with any type of illness. And as we expand our platform, we hope to be able to allow patients of all different types of illness on the platform. And one thing that I think is really special that Peter always mentions is that all diseases are rare diseases because everybody has a different genetic profile. And therefore, we want to be able to eventually on our platform host anybody with any type of disease that wants to further get information and sequencing and other types of data generation about their case, and then connect with researchers around the world to be able to further that. And Our current business model is the platform will be free for all patients and all researchers currently. We are a nonprofit organization, so we're not going to be taking any profit off of this, and we're currently applying to a lot of grants, including this grant here at Horizon Prize today, grants from pharma and other industry who will be supporting our work as we continue to democratize rare disease research around the world.
Great. Thank you. I'll turn it over to Ada.
Thank you very much, Emily, for the pitch, for a beautiful pitch. My question would be looking at the low number of patients you've worked with. Is this in any way connected to the need for funding? And if so, moving forward, how is your funding model looking like?
Sure. Could you repeat the first part of the question? Sorry.
The first part is looking at the low number of patients you've worked with. It's like a period of 5 years, 4 and 3 coming. How is this connected to funding? And if there is a connection, because you mentioned that you want to scale, as you plan to scale, what is your plan on fundraising?
Yeah, that's a great question. So we are a low volume program currently because we wanted to provide the highest quality of personalized medicine to all of the patients that we currently work with. And in realizing that this model works for a small number of patients, we wanted to figure out ways to be able to include more patients in this process. And so current fundraising is raising for every individual case, and we get donations from companies as well in terms of sequencing and everything. But as we move on to an online platform, everybody can have access to that online. And so patients can either, we want to empower patients to either fundraise for themselves or to provide their own sequencing or own data generation through organizations that they come across on their rare disease journey. And we think it's really important that patients themselves are empowered to be able to take action on their cases themselves, especially as somebody who is a rare disease patient herself. It's so incredibly powerful to be able to take charge of your own medical data and medical records, and to be able to have agency in navigating the difficult path that is having a rare illness.
Thank you very much.
Any other questions from Vanessa or Ida?
None for me. Thank you.
Thank you.
Wonderful. I did have one other question from one of the other judges who's not able to join us live. What does follow-up care look like for the patients that you work with? Do you partner with others? What does that look like?
Absolutely. That's a great question. Luckily for us, Gigi is here today. A bunch of patients every patient that we currently work with actually is still actively involved in research to the people and helping us further our mission, and in any way that they can, whether it's, helping us fundraise, helping us run cases, guiding patients through new patients through our current process. And what is really special is that, after we help them generate data and host a case, we continue to work with and monitor these patients over time. And we continue to provide support through our research network and through potential sequencing donations to help patients continue along their journey if they so choose. And so that's been really exciting. And yeah, for our organization, because we're a nonprofit and we've just raised, our first round, this $150,000 from Horizon will go a very long way for us in terms of operations and sequencing and supporting our patients for the future. And thank you so much for having me.
All right. Thank you, Emily, and thank you to the team who's here with her. We don't have any questions from the audience now, so thank you for your presentation, and we'll move on to the next finalist.
Great, thank you.
All right. Next up, we will hear from another finalist virtually, Sandro from the solution Congenica. So again, we will show his video, pre-recorded pitch video to start, and then he'll join us live for some Q&A with the judges as well as the audience. So with that, we'll hear from Sandro.
Rare disease is recognized globally as a public health priority. Despite advances in rare disease diagnosis, the benefits are inequitable across populations. Rare variants tend to be population-specific, and too often studies exclude ethnic minorities to produce diagnostic models that are fair across all ancestries. Our solution aims at using Congenica's unique capability to address this important problem and provide effective, personalized treatments for rare conditions, regardless of the social and racial background of the patients. We are confident we can deliver this project because we are a digital health company which has developed the world-leading clinical decision support platform for the analysis and interpretation of genomic data. Our unique heritage has played a key role in developing our platform for rare diseases, which also include an innovative artificial intelligence frame. More than 150 institutes around the world are using our platform, and we have been selected as exclusive partner of UK NHS Genomic Medicine Service. We are backed by ISO and C certifications, so clinicians can be confident in the quality of their results. And finally, Congenica is a member of the International Rare Disease Research Consortium, and we have always considered the problem of providing access to timely and correct diagnosis to all. Our solution will implement a virtuous feedback loop where the step of data collection and diagnosis is followed by a reinforcement step aimed at using this new data to improve our diagnostic models. In particular, we will select a group of institutes that will be able to use our platform free of charge for the analysis of 10,000 ethnic minority patients. These institutes will be selected by our Patient Advocacy and Engagement Advisory Board with the help of the International Rare Disease Research Consortium. But we will also rely on Horizon Therapeutics expertise to suggest some critical communities and institutes. These institutes will support the advancement of rare disease diagnosis in underrepresented populations, and at the same time, they will collect new data from these minorities. This data will be used to identify and tackle any ancestry bias in our clinical models and develop new ones for specific diseases of interest. And once again, we will welcome Horizon Therapeutics advice to identify and prioritize the disease we should focus on. The proposed solution has great potential. It can significantly improve the diagnostic rate among ethnic minorities and reduce the length of the diagnostic odyssey. In doing so, it will likely make genomic testing more acceptable and reduce the social stigma for rare disease in these communities. We will provide full support to the selected institutes and help them in the whole interpretation process, and this will improve the professional expertise in these disinvested communities. And finally, our solution will provide us with an invaluable amount of information and data to further develop our AI frameworks. And finally, a big thank you to my colleagues that have been working with me on this solution, and thank you.
All right. Thank you, Sandro, for that presentation, and welcome to the virtual panel. You're on the screen with two members of our judging panel, and I'll kick it over to them to ask a few questions. Let's start with Ida, and then we can hear from Vanessa after that.
Thank you very much for the pitch. My question would be, because you've done what you are pitching for already, what lessons would you like to carry forward to improve as you move on?
Well, one of the aspects that we've been always considering is try to get as much data as possible from these ethnic minorities and improve definitely our diagnostic models. So the lesson we learned is that we should definitely consider these ethnic minorities inside our diagnostic models and not take for granted that all the genomic background, genetic background is the same. And this is actually where we are aiming at with this solution. We would like to include a lot more samples from these ethnic minorities to improve diagnostic models, check for any bias towards certain ancestries, and tackle this bias if needed.
Okay, thank you.
And I have a two-part question. Congrats on a great pitch. So when you consider your partnering organizations, what do you require of them? And the second part is, could you elaborate a little bit more on your business model and how you are developing a sustainable solution?
So answering the first question, what we're looking for in our partnering institutes, we're looking for institutes that can access to large ethnic minority groups, but at the same time, they can also provide a follow-up for these patients. So one thing that I want to highlight is that congenital will be completely, we won't select these institutes. They will be done by the International Rare Disease Research Consortium. They have the expertise to select these institutes based on these characteristics. And so this is how we do, how we arrange to select these institutes, and how our business model is actually the same business model of our company. We provide this platform for decision support platform for the analysis and interpretation of genomic data. So the user can upload genomic information and the phenotypes of the patients and get an understanding of the variants that are diagnostic for this patient. So this is the business model. We give the opportunity to use this platform to our users. Of course, they will be charged for using our platform, and this is actually our business model. In this case, we won't charge our customers, but we still provide all the support they need to go ahead with the interpretation process. And I would like to highlight that this is very important. What we are going to do is that we are not going to get any revenue from this project. What we are going to get is data that will improve our diagnostic models, and in this virtuous feedback loop will be fed back to improve the diagnosis for the patients that were undiagnosed before, but for the future patients that are also will be presented to the doctors.
Okay. Thank you.
Thank you.
Thank you.
I also had one other question from a judge who's not with us live. How might your approach to care or to your solution change as you expand to different diseases and to different populations?
That's a very good question. Well, I think our approach will still remain the same. Provide the same support and the same assistance to all patients. Yeah. We will provide our platform to all the institutes they want to use our platform, and in the future we won't actually change anything. We'll just probably will get more specific into our diagnostic models, so we will have to get this diagnosis faster, and having this diagnosis in a very timely way for patients with rare disease is crucial. So our model will evolve with our platform and will help in improving the life for patients affected by rare diseases.
All right. Thank you very much, Sandro. That's all the questions that we have for today. I want to also thank Vanessa and Ida for asking the questions too.
Thank you all for the consideration and opportunity to be here today. Thank you.
Wonderful. All right. So those are the 5 finalists. Those are the 5 finalists to the Horizon Prize. This is the inaugural Horizon Prize as well. We were totally stunned by all the applications that we received. When we launched this challenge, we never really imagined that we would see such innovative and impressive solutions impacting lives all over the world. So thank you to each of the 5 finalists for participating in this session today, and to our judging panel who have worked over the last few months to evaluate dozens of solutions that were submitted to this challenge. Regardless of who wins later today, we're confident that all of you will continue to impact the communities that you serve, and we hope that you'll continue to follow the Horizon Prize and solve challenges as you go forward. Perhaps there's a chance to connect in the future as well. I also want to thank our partners at Horizon Therapeutics and, like I said, the judging panel for their support in the selection process and making this possible in the first place. I invite everyone who's here today in the session with us in New York, as well as virtually, to tune in later today to hear the finalists, to hear which of the finalists will be selected as winners to the challenge. So we look forward to seeing you there. And until then, I thank you all for spending some time with us today for the pitch session here at Concordia. Thank you very much.